Today we'll study anti-rabies serum. In this class, we will study what is rabies and what is meant by anti-rabies and how the rabies is transmitted and symptoms of the rabies, along with that clinical types of the rabies and anti-serums, along with that ERIG and HRIG and mechanism of this anti-rabies serums. Along with that is the, according to WHO, the vaccination against the rabies, along with that pre-exposure and pro-exposure vaccination that we will study, and that is along with that rabies category, exposure category, we will study one by one. First we will study the what is anti-rabies serum. Okay, anti means against, rabies, it is a virus. That is rabies, the term, it is originated from the that is Latin, that is rabor. The rabor means the rage. Here the rabor or root of this rabies is the Sanskrit word coming from, that is the rabas. Rabas, it means that is the to do violate or the madness. Okay, the term rabies is mainly its root is from Sanskrit, that is the that is rabas, it means that is madness. Okay, and serum, that serum is anti-serum, that is produced, antibodies produced in some other animals or human beings, that is the one type of passive immunity. Okay, this is about the anti-rabies serum. Now we will study one by one. What is the definition of the rabies according to WHO? According to WHO, the definition is a viral zoonotic disease cause progressive and fatal inflammation of the brain and spinal cord. It means that it is one of the viral zoonotic disease. What is zoonotic disease? Zoonotic disease means that is the diseases which are transferred from animal to the human beings. That is the transferable human to human beings. It is a viral disease, that is the one of the progressive and fatal inflammatory disease to the brain and spinal cord. The virus is, that is the rabies lyssa virus. Okay, this is the virus. Lyssa means, the term lyssa means that is the violence. That's why this virus name is given rabies lyssa virus. Okay, now we'll study the transmission, how the rabies is transmitted. Okay, the rabies is transmitted through the bite of rabid animal. That means that is the viral transmitting, that is the infected rabies animals here, which shed infectious virus with their saliva. In their saliva, the rabies virus is present. Example, the dogs, cats and jackals and so many other animals. These are the transmittable rabid animals. Now we'll study what is the symptoms. Okay, what happens, what are the symptoms are produced due to the rabies. The symptoms are, in the early stage, the fever, headache, excessive salivation, muscle spasm and paralysis, mental confusion and hydrophobia. Like these symptoms are produced due to rabies disease. Now we'll study the types. Clinical rabies. Clinically, rabies has two types. The first one, that is a furious rabies. It means that characterized by hyperactivity. The person is in a hyperactive. This is the first category. Second one, the paralytic rabies. In this stage, it is characterized by paralysis and coma. It means that the rabies we are dividing into two types, that is the furious rabies and paralytic rabies. Okay, this is about the clinical symptoms. Now the next term is, that is anti-serum or immune serum. Already we studied in the last classes, in the last videos. What is anti-serum? Again I am explaining. That is a blood serum from the person or animal whose body have built antibodies is called as a anti-serum. Okay, already we will discuss. That is it is a one type of passive immunity, that for we are giving that antigen to the animals or the persons, in that we are producing the antibodies, and that blood serum we are taking and injecting the person who are exposed to the animal bite. Okay, that is the rabies bite. In this serum we are giving. Okay, this is about the anti-serum or immune serum. Okay. Now this provide temporary. What happened? This serum, that is the anti-rabies serum, it is provide the temporary or passive immunity against the disease. It is not a permanent. It is a temporary relief, or there is temporary passive immunity. It produces temporary passive immunity against the rabbit, and it is used when person has already exposed or contracted, that is the contact the disease. Okay. When we are giving the serum, in that cases only the person is the bite or exposure. In that cases only we are giving this anti-rabies serum. And next uses where we are using this anti-serum for the post-exposure prophylaxis against the rabies only. Okay, whenever this dog bite, in that only, that is the post-exposure. After the exposure only, for the prophylaxis we are giving against that rabies. Okay, this is about the post-exposure. This is the use. Now it is mainly categorized into, that is the ERIG and HRIG. This first of all the ERIG, that is equine. Equine means horse. Here that is equine rabies immunoglobulin. Okay, already I told this is the one of the immunoglobulin, that is the antibodies produced in the horse. Okay, it means that is the antibodies serum equine is originated derived from the plasma of the animal of the horse. That is the rabies antigen we are injecting in the horse. In that horse, after few weeks it is produced antibody. That antibodies we are taking separate out, that is called as a equine rabies immunoglobulin. Okay, this is giving, okay, this is a giving to prevent the rabies, that is the treat the rabies patients. Okay, this is the producing. Why it is called equine? Because it is the serum is originated or derived from the horses. The second one, this same we are injecting in the human beings. The antibodies are producing in the human beings. HRIG, this is called human, H for human rabies immunoglobulin. Okay, it means that this rabies antigen we are injecting in the human beings. In that human beings, after few days the antibodies are produced. That serum we are separate out and we are injecting in the dog bite patients or the rabbit patients. Okay, here this is the human rabies. Here antibody serum we are derived from the plasma of the human beings. Okay, now the dosage, that is the ERIG, the dosage is, that is 40 international unit per kg of body weight. And the second one, that is the HRIG, human rabies immunoglobulin, we are giving the dosage 20 IU per kg of body weight. This is about the ERIG and HRIG. Okay, now we will study the mechanism of action, how this anti-rabies serum is act. What is its mechanism? The mechanism is, this anti-rabies serum is works by binding the rabies virus and neutralizing it. What is doing it is, here whenever you are injecting this rabies serum, it is neutralizing the virus. Okay, neutralizing the toxic effect of the virus. That's why the symptoms are not produced and antibodies are produced. It means that virus is neutralized by giving this injection. This is the mechanism of action or mode of action. Now we'll study the site of injection. Okay, the where we have to give HRIG, or that is the anti-rabies serum, where we have to give whenever the patient come to your hospital or OPD. In that cases the dog bite patient is came. In that, the first of all, where we have to select the site of injection, the injecting HRIG into the around the wound area. Okay, suppose the dog bite is here, then we have to inject the surrounding area only. This we have to select that wherever the bite is there, in that only we have to inject this rabies serum. It is also called as a, that is the HRIG. Okay, preferably according to WHO, the ERIG and HRIG is considered as a superior comparative to the serum of the horses. The human serum immunoglobulin is considered as a best one for treating rabies. Okay, what we have to give? Inject at the site of the dog bite and surrounding, that there only we have to give this injections. Okay, now this is the immediate protection against the rabies. Okay, whenever patient comes, this is the immediate protection against the rabies, and HRIG administered within 8 days of exposure. Okay, as much as possible we have to give, other sense, otherwise we have to give within 8 days of the exposure. Okay, this is about the site of injections. And next come to the that is the anti-rabies serum alone does not act. Okay, you know that is the there is a two types of treatment. That is the one is the vaccination of the rabies, and second one is the immunoglobulins. That is the serum. Here, the anti-rabies serum alone does not guarantee on the anti-rabies treatment and should always combine with the anti-rabies vaccination. It means that this serums whatever giving, this is only for the earlier. It means that is the antibody prepared form in the early stage we are giving. That is the ready-made immunity we are giving. That is a passive immunity, but that is a it is not a complete treatment. Here what we have to give, the both serum, anti-serum along with that vaccination, if you will give, then only considered as a that is a complete treatment of the rabies here. Okay. Now, according to WHO, the vaccination against the rabies. Okay, how we have to give the vaccination? The vaccination is, it is mainly categorized into two types. That is the pre-exposure vaccine and post-exposure vaccine. Pre-exposure vaccine means there is a no exposure, there is a no dog bite. In that cases also we are giving for the protection to the persons. Those are veterinary doctors or the animal handlers. In that we are giving the injections to prevent the rabies disease. Okay, the chances are there is exposure, that's why we are giving the pre-exposure vaccinations. Okay, these vaccines, anti-rabies vaccines, we are giving in the as a veterinary doctors or animal handlers or certain laboratory workers. In that we are giving pre-exposure vaccination. Now come to the dosage. The dosage is the mainly two dose we are giving. Okay, that is the pre-exposure, that is the two doses of rabies vaccination. That is 1 ml given in the deltoid regions, one injection per day. That is the 0 and 7th day. Two injections we are giving as a pre-exposure, 0 and 7th day. Okay, why we have to select deltoid only? Because the muscle mass is very less and fat is very less. That's why it is acting very fast. Okay, comparative to the other site. Okay, now come to the post-exposure vaccines. The post-exposure vaccines, it means that if the person, the dog bited, okay, the dog bite is there, after exposure only we are giving the this vaccine, that is called as a post-exposure vaccine. In this case, to prevent the development of the clinical rabies after exposure. Okay, it means that this is the preventing the symptoms, clinical symptoms we are giving. This is the post-exposure vaccines. Here the main difference is pre-exposure, post-exposure. Pre-exposure means for the protection of the rabies, and post-exposure is the for preventing the clinical symptoms. Okay, this is about the post-exposure. Now we'll study that is the post-exposure that is a prophylaxis regime, that is called as a PEP regimes. The PEP regime is mainly categorized into two types. Already I told, that is it is a combined treatment, that single vaccine or single serum is not acting. That's why the PEP, the post exposure prophylaxis regime, it is told the first thing what we have to do whenever the patient is come after exposure, after dog bite, the first thing what we have to give, the first is administer the HRIG given only once. Okay, already I told, wherever the dog bite is there, that select area around that only we have to give that inject HRIG, the serum, that is the anti-rabies serum only we have to inject, or the only the wherever the bite is there, that site only we have to select and give. The second thing what we have to give, second things, that is another 4 injections of the vaccines we have to give. Okay, this is about the serum. Second one is the vaccine. The second is 4 doses of the vaccines we have to give to the patients. That is the 1 ml given in the IM. 1 ml given IM. That is the 0, 3, 7, 14. Okay, like almost double. That is the 0, 3, 3 to 7, 7 to 14. 4 dose we have to give the patients. Okay, that is the first is the first 0 we have to consider within 24 hours we have to inject the injection, the vaccines, that is the first dose. Second after 3 days, after 7 days, and after 14 days. This in the normal peoples we have to give these 4 doses of the anti-rabies vaccines. Okay, suppose the patient is a immune compromised persons, in that we have to give extra another dose, that is on the 28th day, again 5th dose we have to give. in that patients. Okay, it means that normally we are giving 4 doses, but immune compromise, in that we are giving 5th dose on the 25th day, this 28th day. Okay, this is about the PEP regimes. Now we will study rabies exposure category. According to WHO, the WHO is categorizing it is mainly 3 types, that is the category 1, category 2 to category 3. Okay, the rabies exposure category, the first category is, that is the first category, it is called as a liking, touching on the skins. Suppose the dog is lichen or touching on the skin, that is called as a first category. Here there is a not required, PEP treatment is not required, just you have to wash it and leave it. Okay, it means that the dog is lichen or it is just contact, okay, on your cloth, that it means this is the category 1, there is a treatment is not required here. This is the category 1. Now come to the category 2. The category 2 is, that is the saliva on scratches on the abrasion and skin without bleeding. Okay, without bleeding, the skin abrasion is there, and nibbling, uncovered skins and minor scratches are there. This is called as a second category. Here the second category, what you have to do? Okay, the first thing we have to do, immediately after the dog bite, just you have to clean that wound through your that is soaps. We have to clean that wound. After that, the rabies vaccination we have to give. This is the second category management or recommended dose of the PEP. Now the third thing is, that third category, this is the most important. Okay, mostly the patients come to your OPD, this is the third category. Here this is the third category where which we have to consider as a third category, the bite, deep bites or multiple bites of the animals like dog and cats, and scratches or the penetrating skins and likes on the broken skins or bleeding skins, the some dogs liked, that is also considered as a third category. In this, what we have to do, the PEP recommendation is that the treatment, first thing we have to clean the wound. First we have to clean the wound with the soap. Okay, we should not bind that wound. And next is rabies immunoglobulin injections. We have to inject wherever the site is there. Okay, in the third category, where the bite is there, in that bite surrounding, okay, surrounding, that is the, if you are selecting the HRIG, the dosage is 20 international unit per kg body weight. We have to give the injection or the site of the bite or around the bite. Okay, this is the first thing. After that, what you have to give? Second is the vaccinations. Second, already I told, the single serum is not recommended. That's why we have to give the vaccines also. Okay, we have to give the vaccines, rabies vaccinations. Already I told the vaccinations, that is the 03/7/14, the day we have to give the vaccinations. Okay, this is about the rabies vaccination. This is the third category management of the rabies. Now the next thing is, it should be given as soon as possible after exposure, within 24 to 48 hours. Okay, it means that as much as possible early we have to treat the patient. Why? Because if you are giving this anti-rabies serums, because the ready-made antibodies we are preparing, that is ready-made antibodies we are injecting, that covers only 7 days in the patients. After that, if you give the vaccines, okay, the vaccines in that patient, it will take more than 7 to 8 days to produce the antibodies, and after that the vaccine they will prevent. It means that the first 7 days this anti-rabies serum are able to prevent. Their ready-made antibodies are their passive immunity, they will manage. After the 7th-8th day, the vaccines will produce antibody, they will manage. Okay, this is about the anti-rabies serum brief information. Okay, thank you for watching. Please subscribe channel, please share and share it. Thank you.